Okay, everybody, let's dive into the case of Allison, 38-year-old wife of a wealthy, successful business exec, devoted to his work. It looks like the couple decided early in their marriage that they would not have any children. Allison was trained as a social worker. Yeah, way to go, Allison. And worked full time for 3 or 4 years before meeting her husband. So we got a lot of context there. She continued to work part time for a couple of years after her marriage, but eventually became frustrated, feeling that despite the endless work, she had little effect on the problems around her. Yeah, that's kind of typical of burnout, especially in social work. So, okay, so she's going through what appears to be some burnout, possibly feelings of, let's see, became frustrated, um, and feeling that despite the endless work, she had little effect on the problems around her. So, if anything, I would say this would probably be some indication of some depressive symptoms. Usually, that comes with burnout. Okay, so we have possibly some depression to explore at this point. Let's see. Allison finally quit her job when the couple moved to an expensive suburban. Let's see. Moved to an expensive suburban several miles outside suburb, several miles outside the city. The couple joined a country club. Allison spent her time doing volunteer work in a local children's hospital and playing tennis with her friends. So, I mean, at this point, wow, okay, she moved. She's getting back involved socially. She's got some interests, volunteering. So, okay, good for her. It seemed like she kind of adapted and is doing pretty well, pretty resilient, protective factors at this point. Her husband was too busy to spend much time at the club. Allison had always confined her drinking to social occasions, but now began drinking more as she felt increasingly lonely and empty. So here we have kind of the event, the situation that's given us some clues where her behavior, something is becoming excessive or likely out of the norm. And in clinical work, that's what we're really looking for are things with regard to behaviors, thoughts, emotions that are now kind of becoming much more frequent or much more intense or outside the norm. That, in essence, is, to be honest with you, is clinical work. Is just looking what is falling outside that bell curve of the norm. So what we see here is that she had confined her drinking to social occasions, but then she began to drink more as she felt increasingly lonely and empty. And these are kind of going back to this idea of, this up here, of depression. So, lonely and empty, those are pretty kind of good indicators of depressive symptoms. Then it says lunch at the club after tennis usually included one or two cocktails, which at that point, I'll give that to her. I don't think that seems excessive. But later in the day, after her volunteer work or shopping, she frequently stopped at a local restaurant with friends and had a few cocktails before going home. So now we're drinking several drinks or almost a handful of drinks within what seems to be, a few hours worth of time or a half day's worth of time. Allison's husband often worked late, so she had one or two more drinks. So if we start adding these up, we have one or two there. Later in the day, we have a few more, and then we have one or two more while preparing dinner. And then finally, before bed, she has a nightcap. So much of her day at that point, if we look at if we look at all of these kind of instances here, as clinicians, we're looking at the frequency. Now what we need to do is look for the severity and the impact, right? So we have the frequency coming on. As a clinician, we're looking for behaviors that are now kind of picking up and how often they're occurring. Obviously, now she's drinking throughout the day. Her husband's job required periodic business trips lasting several days. Allison sometimes accompanied him but found the trips lonely and boring. On the days he was away, her drinking increased substantially in the evening. Okay, so again, this is increased drinking. So she's, again, kind of the frequency of that and the increased amount is now going up. Usually, again, this is likely along the lines of what we call tolerance, which the drinking is increasing in order to achieve the similar effect that she once had, or the ability to have that similar effect is taking more and more alcohol, and so this tolerance now is becoming part of her life. So one morning after her husband had been gone for several days, Allison awoke late in the morning sweating. So we'll change this. Sweating, feeling nauseous and anxious as her heart raced. Okay, so we have several. So right here we have several physical indicators or physical criteria that are being met for within the alcohol or substance use category. We have the sweating, feeling nauseous and anxious. So typically that is indicative of either a person that is intoxicated or possibly going through withdrawal symptoms. So when it's pointing out kind of immediate physical sensations, we're likely now looking at some sort of intoxication diagnosis or a withdrawal diagnosis, because this is currently happening. This is kind of a snapshot in the moment. It's not necessarily a substance use disorder with regard to an overarching view of the behavior. This is more particular to what's going on in the moment, which is normally indicative of an intoxication or withdrawal type of diagnosis. So it also appears that her hands shook as she got out of bed and went into the bathroom. So she also has these shaky hands, tremors, where she then vomited, it looks like. She felt like she couldn't sit still and began pacing around. So here we have this anxiousness and restlessness. She's pacing down the hall to her living room. She poured some liquor into a glass and tried to drink without spilling it. So her hands are trembling, all of this going on. And again, the key thing is Allison awoke late in the morning. So it doesn't tell us, the thing that I guess we can assume here is that she was asleep, and so therefore she hadn't been drinking. Perhaps she had drank the night before. So here we have that she awoke, she hadn't been drinking, and then now she's experiencing these physical effects. It doesn't say that she awoke and then began to drink, which would be more intoxication per se. Here it's as though she awoke and then she was having these because there was no alcohol in her system, potentially more of a withdrawal type of situation. So I'm just going to kind of write that down here, that we're talking potentially withdrawal symptoms. Within a half hour, it looks like after she had that drink, she began to calm down. Her hands stopped shaking. She felt better. She got dressed and went to the club for tennis. So what did we learn from that? Well, we learned that the alcohol appeared to be kind of the what do I want to call it? The coping skill that she used then to treat self-medicating is what I was looking for. Self-medicating to help stop the hand shaking, and it appears that it did. Again, letting us know that her body appeared to be going through some sort of withdrawal symptoms. Upon drinking and taking in the alcohol, the symptoms went down and decreased, which then is indicative again that the body has been used to needing the alcohol to address these physiological symptoms. There's a tolerance that appears to have been built up that when she withdraws from that, her body goes into this reaction. And so these withdrawal symptoms are certainly present. So with that being said, if I turn to the lovely DSM TR here on page 556, we look at the alcohol use has been heavy and prolonged. So I would say for the most part, yes, if we're going off the fact that she is drinking pretty much throughout the day now, and it's increased substantially as it sounds like in the evenings. So criteria A, it looks like that she's had heavy and prolonged use of alcohol, so she likely already has qualified for alcohol use disorder, generally speaking, as an overarching diagnosis. In this case, on the withdrawal diagnosis, it looks like 2 or more of the following needs to have developed within several hours to a few days after the cessation of alcohol use in criteria A. So, after having drank heavily, within hours to days. In this case, we can imagine that she was heavily drinking in the evening, and then the next morning she awoke late, so it had been obviously multiple hours at that point. And then it says there needs to be 2 or more of the following, so we can go down. First one is autonomic hyperactivity, so sweating, which we have. Increased hand tremor, which we have. Insomnia, we don't really see any of that here. Nausea or vomiting, yes. Let's see, visual or hallucinations or illusions, we don't see any of that right here. Psychomotor agitation we see as she's pacing up and down the hall, couldn't sit still, so that one's check. 7's anxiety, so she felt anxious as her heart raced, so check. And then generalized tonic-clonic seizures, which we don't have any indication right now of any sort of seizure activity. And then it goes on to say that it's causing some sort of distress or impairment in her life. This would take likely some additional questioning of her, with the husband not being home or being frequently away. Again, let's just for this sake say that it's likely beginning to cause something. I mean, in reality, you would need to explore this more with her to see the amount of distress it's having on her life. For the sake of this scenario here, let's just say that that's likely becoming the case. And then criteria D is that there's no other medical condition. And as far as the specifiers, we really don't have any auditory or visual hallucinations at this point or perceptual disturbances. So at that point, it looks like the code for like a mild to moderate severe or mild to moderate alcohol withdrawal and possible alcohol use disorder along with that would either be, it looks like, so if I'm going to write this down, looks like the coding would be, looks like the coding would be along the lines of F10.130 if it's more mild, and it'd be F10.230 if we're talking moderate to severe, with alcohol use disorder being comorbid with that. At this case, boy, given the amount of signs and symptoms she has, we just don't know a lot of the distressors and the other behaviors going on, but we do see the amount of signs that she's having for the withdrawals. My clinical judgment is this is definitely bordering now on more of the moderate level. I'd probably stick with this with more exploration. Again, you'd have to find out a little bit more about the impact and distress it's having on her, but for the sake of the scenario, let's just say that it is. So all in all, what we're going to do here is this then would be termed alcohol. This would be a case of alcohol withdrawal. And again, the reason is these symptoms down here are occurring after having gone without the alcohol all night, and so she's waking up in the morning, and that it's taking the drink, the liquor, to then calm these physiological symptoms that are occurring. So there we go. This is a really good example of what can happen in a withdrawal state. And again, those are the codes that go along with the DSM, comorbid with the alcohol use disorder, which is pretty typical at that point. So there we go. This is a case of Allison. If there's any questions, let me know. But this is a great example of a person in a withdrawal state.